Welcome, Claire. Really
Hi,
nice to see you. Thank you
nice
for
to
joining
see you.
us tonight and giving us your evening.
No worries.
Um,
Nice to be here.
Good stuff. Well, I just thought we'd say Claire's got some cats that might join us
Yes.
as well for the session. So
Yeah,
they're
I feel
very
there
cute.
always has to be a disclaimer in case one of my two cats appears in the background.
Yeah, yeah. They'll make it more interesting, definitely. So, Claire, I thought it might be useful if you're happy to share a little bit about yourself, and about your sort of personal experience of your diagnosis and living with secondary breast cancer. To start, if you're happy with
Yeah,
that.
yeah, of
Thank
course.
you.
So my name's Claire. I was originally diagnosed with primary breast cancer back in 2015. And went through all I mean, I had quite a difficult diagnosis, just in terms of trying to get the initial breast cancer diagnosis. There was quite a lot of delays, and I was told I had mastitis and a whole load of other things, and it went on
Mm,
for weeks and weeks and weeks. Um, but once I'd had my diagnosis, things moved along fairly quickly, and I went through the kind of usual treatment that you would, so chemotherapy, radiotherapy. I had a mastectomy, to the left side, and carried on through kind of my 6 rounds of chemo. And then I had a scan at the end, which I think everyone hopes that you have the all clear. And unfortunately, that didn't happen for me. I was
right.
confirmed, with bone mets. So I had, basically, my breast cancer had already metastasized to
Okay.
secondary breast cancer, just not confirmed at the initial stages of my diagnosis. So I have bone mets. I have them in three places at the moment. So it's my ribs, my lower back, and my sternum.
Okay.
Um, and I have to be honest, it's really my lower back one that gives me the most problems.
Mm,
But yeah, so that was confirmed in about March of 2016.
okay.
Um, so I've lived with secondary breast cancer now for quite a while. Actually, this I was thinking about this the other day, and I'm kind of 8 years living with
Mm,
SBC now, kind of nine
mm,
years in March. And I've gone through various stages of how I feel about secondary breast cancer and how it's impacted me, and sort of how it's challenged me, and how it's really shaped where my life is going and where it's become and to where I
yeah.
am now. Um, I'm very, very lucky in that I'm very stable in my disease.
Hmm.
I'm still on first line treatment. So I
Okay.
have ER positive, so hormone receptor breast cancer. So I'm on letrozole. I take a bone strengthener. I have had my ovaries out since, ongoing through my
Mm,
treatment, and I've since had a further mastectomy so that I now live flat.
okay.
That was personal preference, just because I was left kind of lopsided.
Mm,
Um, but that in itself was a challenge to
yeah,
get
I'm
that.
sure.
So I've gone through lots of different stages, but the one thing I am very lucky to say is that I have been stable
Mm,
throughout. And that's kind of shaped where my work life has gone. That's kind of shaped where my personal life is, and
yeah.
things like that. But yeah, my diagnosis, I have to say, it wasn't a shock. I
Okay.
lost my own mother to secondary breast cancer,
Right.
back in the 90s. So I was aware
Mm,
of kind of what breast cancer was, for one, but I was also aware of what happens when it does metastasize.
mm,
My mum's own death was quick, and there
mm.
wasn't a lot of treatment back then in the 90s.
Okay.
So it was pretty brutal to watch as a
Mm,
17-year-old. It wasn't great. So there was a lot of fear that came with my own diagnosis, because the only real experience I had of it was my mum.
yeah.
Um, so I've since learned that things are very different now, and my own experience has taught me that.
Mm,
My experiences with other members of the community, but
mm,
yeah, it's been a massive learning curve, having SBC. Not only educating myself about it, but trying
yeah.
to educate my friends and family, and other people. But yeah, pleased to say I'm living well at the moment.
Yeah. It's a I guess a positive story in a way, despite the diagnosis
Yeah.
that that you are living so well. And did were you getting any symptoms from
Um,
the metastases at the time?
I don't remember having any, but I had back pain. Even prior to my primary breast cancer diagnosis, I had back pain, but I'd kind of put it down to a work injury that I thought I had at the time.
Mm,
But really, the first sign that made me want to go get checked initially was my left breast started to swell.
mm,
Um, and it was also kind of, I was having electric shocks almost,
okay.
and pain, and it was hot to touch. So all
Mm,
of those symptoms were the first visible signs that I had,
okay. Yeah.
and that's what led me, to go and be seen.
Mhm.
And that's where the kind of mastitis
Yeah.
misdiagnosis and things came from, and antibiotics weren't working. So it took a
Yeah.
good number of weeks to be seen at the breast clinic. But after that, as I say, it all moved very quickly. But
Yeah.
in terms of the back pain, I didn't correlate that with
No.
breast cancer.
Mm.
I know better now, but at the
Yeah.
time, I really did just assume that it was the after effects of a work injury that I'd had where
Mhm.
I had actually hurt my back.
Mhm.
I also had what they thought was costochondritis, which was a pain in my side, my rib, which actually where my bone met is. But I was being treated with physio for that. And I think when I look back, it wasn't any of those things.
Yeah.
I think it was the signs and symptoms of secondary breast cancer. I
Yeah.
just I just didn't really put it all together at that point until after I'd had my
Yeah.
diagnosis.
And I
Yeah.
think that's quite difficult, isn't it? It's deciphering what those symptoms that you should worry about and those that could be
Yeah.
caused by something, totally unrelated. And it's really hard, isn't it?
Yeah.
And I guess what we would always advise is if there's anything new that you can't explain, then you
Yeah.
should always get it checked out. But it's
I mean,
hard. It's really hard.
yeah, I'm forever saying that to people that
Yeah.
you're better off going and being
Mm.
checked, even if it ends up being nothing.
Yeah.
Unfortunately, in my case, I went to see them about certain things, but
Yeah.
breast cancer wasn't really ever in the
Yeah.
equation until after I'd been diagnosed. But I
Yeah.
would still, I think, if I'd had any, if I hadn't been diagnosed straight to secondary after my
Yeah.
treatment, I would have queried these
Yeah.
ongoing pains, just because of the kind of experience that I'd had and I'd seen
Mm.
previously.
Mm.
But I know not everyone does that and not everyone's told that.
Yeah.
And I think it's something that's really important
Yeah.
that even if you've had a primary breast cancer diagnosis, it's not to scare anyone,
Yeah.
but you should always be aware of what to look out for because not
Yeah.
everything is just a cold or not everything is just, back pain
Mm.
or side
Mm.
pain. There may be an
Mm.
underlying reason for you having that. And I
Yeah.
don't think you should worry about wasting anyone's time. You should
Yeah.
go and get
Yeah.
seen. Certainly, that would be my advice anyway.
Yeah. Completely agree. Yeah. I think there's a lot of people do worry about bothering their team or bothering their GP, but healthcare professionals would always rather know. And obviously, the
Yeah.
sooner these things are investigated, the
Well,
better, really.
that's what I was just going to say. I
Mm.
think for your own sake, the earlier that these things are
Yeah.
detected, the
Yeah.
better chance you have of
Yeah.
either if it's a primary having a curable
Yeah.
diagnosis other than when it becomes too late and it's
Yeah.
metastasizing. While you can treat it, you can't cure it.
Yeah.
So you're then going to end up in this cycle of,
Yeah.
lifelong treatment. So
Yeah.
I don't think anyone should ever be afraid to go, no matter
Yeah.
what it is,
I
or whether
completely
you're made
agree.
to feel paranoid or not. Just
Yeah.
go and be seen would be my
Yeah.
advice. Yeah.
Yeah. Completely agree. And so at the moment you said you're on first line treatment and you're on hormones. How have you found that treatment?
Um,
Have you had many side
I
effects
mean,
or?
I have to be honest. I've been fairly lucky.
Mm,
I've heard other people have different things,
yeah.
but apart from kind of joint pain, I would say, from which I put down to the letrozole.
Yeah.
Um, I have had a really bad sort of case of the menopause side of things where because I went sort of almost into a medical menopause, it
Yeah.
was kind of overnight, and it was really quite a shock to my system. There was a lot of things that I didn't understand that were happening to
Mm,
me, particularly after I'd had my ovaries out.
yeah.
I almost instantly became incredibly depressed
Mm,
and very low mood and very erratic and not really understanding the mental side of it.
mhm.
But really, all it was just my body trying to stabilize from
Yeah.
because I've basically got no estrogen
Yeah.
going through my body because that's what my cancer feeds off. So
Mm,
there was a whole learning curve that I had to understand, that didn't necessarily come from the medical side either.
Yeah.
They prepared me for what they said would be the physical recovery, but not necessarily the mental side of
Yeah.
things. And when you
Yeah.
don't understand what's happening to you, it can be quite scary.
Yeah.
Um,
Definitely.
so I do go through a lot with menopause. There's a lot of
Mm.
hot flushes and a lot of lack of sleep, and brain fog is a massive thing. My brain function is very different, and things that I used to be able to do in my working
Yeah.
life, I'm not quite as good at anymore, or I can't multitask the way I used to.
Mm.
So, there's a lot of that side of things. But in terms of physical, I would say there's joint pain.
Yeah.
I have developed degenerative disc disease,
Okay.
which has nothing to do with my cancer, believe it or not, but is a side effect of my treatment and
Yeah.
how long I've been on the drugs.
Yeah.
And it's kind of where my bone met is in my lower back. I have a bulging disc, which
Okay.
for a couple of years ago now, it did really affect my mobility. I was using a stick, I was using crutches, and
Right.
it kind of changed overnight. And that for me was
Mm.
quite difficult. What I thought initially was sciatica turned out to be this. So,
Disc. Yeah.
and it was explained to me that unfortunately it's a side effect of your treatment. But I would rather be on the treatment than not. So if these are things that I can try and combat, and if there's pain relief I can take, if there's things that I
Yeah.
can do that mean I can stay on this treatment that's working and is clearly working for me,
Mm.
I don't really want to change that aspect of it. So
Yeah.
for me, it's been about adapting
Yeah.
to things, and adapting to the different side effects that may appear. And that's about speaking to your team, and it's about
Yeah.
sharing advice with other people that you know and asking what they did, or,
Yeah.
so really for me, it's always about learning
Yeah.
and about adapting to things. And I'm quite a stubborn person. I'm quite a strong-willed person. So I always try very hard to maintain the lifestyle and the pace that I want to live,
Yeah.
but understanding that that might come with some
Yeah.
adjustments.
Yeah.
So
Yeah.
that is what I try to do
Yeah,
anyway.
that's great advice. We've had a few questions in actually, Claire, and one of them is from another
Yeah.
Claire.
Okay.
He's asking what's your treatment plan, if you don't mind
Hello.
sharing. And I think you mentioned that you're on the letrozole and the bone
Mhm.
strengthening treatment.
Yeah.
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 Um,
My treatment, actually, for me, doesn't impact me too much. There's not a lot of hospital appointments. My
mm,
my drug regime is all tablet form,
yeah.
and it's at the moment it's repeat prescription. So, I take one tablet a day, which is my letrozole and my bone strengthener.
Mhm.
And I take Stixerol D3, which is the equivalent of Adcal, which I think a lot of people take for
Yeah.
calcium. Um, and because I've had such a period of stability,
Mm,
it's allowed me to, in connection with my team and discussing it, increasing my period of scans.
mm,
Um, and that for me has made my life day to day a lot
yeah.
easier.
Okay.
So I started out as every 3 months, as most people do.
Yeah.
Um, and then the longer that I had a stable scan,
Yeah.
we talked about increasing it. So
Yeah.
it went from 3 to 6 months to 9 months, and I'm now at a year.
Okay.
Um, I have to be honest, I'm not comfortable going longer
Mm.
than that.
I was going to say, how does that feel for you?
It's been an adjustment each time, but
Yeah,
it's been a conversation I've had with my team,
yeah,
and it's been about a decision that I've been comfortable with.
yeah,
Um, what I didn't cope very well with was anxiety, which I
yeah,
think a lot of people have, and
definitely.
that's always around your scan, and
Yeah,
it sort of brings everything to the forefront about, am I well?
yeah.
Is there, and that for me just wasn't helpful for me.
Mm,
It would be very different if I hadn't had stable scans. Don't get me
yeah,
wrong. I think it was all led by that, but
yeah.
I think when you've had, in my case, none of this really changed until about 5 years into my treatment. So
Mm,
I'd had a very long spell of,
yeah,
you know, and then we slowly worked it. Can I increase it? Will that be
mm,
okay for me if I increase it? And, you know, it all comes from just being stable.
mhm,
And I actually have no evidence of active disease. So
yeah,
I think that helps in these
yeah,
decisions. But for me, day to day, my treatment is every morning I take my little tablets and I take my course and that's me for the day, and I just carry on like that until an appointment appears in my calendar that's to go visit my oncologist or to have a
Mm,
scan. But I know
mm,
that's not the same for everyone. I know
yeah,
that's probably quite unusual. I don't know that there's many that don't see their oncologist regularly or don't go for treatment regularly, but I just think with me being on a tablet form of treatment, it's allowed that for me, which in turn has helped me, as I say, with the life that I want to live or the
yeah,
work that I want to still be able to do. And, I still work full time, so that's important to
yeah.
me as well. So it's allowed me to do all of those
Do
things.
that. I guess it's finding the balance that works for you, isn't it? Because, like you say, having some
Yeah.
people find having the regular scans reassuring,
Yeah.
but then
Yeah.
it causes a huge amount of anxiety as well.
Yeah.
And like you say, that constant
I think that's
reminder.
that. I think
Mm,
it's got to be an element of both, and it's got
yeah,
to be what you're comfortable with, what your
yeah,
team's comfortable with, but have that joint conversation because
mm,
that's happening to you.
yeah,
So while I would always refer to what my team says, I think there's an element of, me being able to have a say in what I
mm,
want, and as long as it's fine by the team,
mm,
then I feel that I'm confident in making
yeah.
those choices, and
Those
it's what
choices.
it's
Yeah,
what works for me right now.
yeah,
That's not to say everything wouldn't completely change if I have a progression. I'm fully
sure.
aware that we would then go back to square one and we would,
Yeah,
it would all change. But
yeah.
right now, for me, this is what's working, and I'm happy with that. So,
That's
yeah.
great. We've got a message from Sarah who said she's just in the about 3 weeks ago been diagnosed with stage 4, a
Yep.
recurrent lung and bones, and sounds like she's probably been put on similar treatment to yourself, Claire. I wonder if you've got any sort of advice or any guidance that you can give Sarah. I'm sure it's a
I
really,
mean,
really tough time.
yeah, I mean, I think for anyone who's newly diagnosed, it's incredibly scary.
Yeah,
It was incredibly scary for me.
yeah.
I am a lot further along, and I don't really like the word journey, but it's the only one that ever comes
I
to my
know.
mind when I talk
Yeah.
about it. But I'm a lot further along now, and my feelings have changed, and my thought processes have changed over time with my own experiences. But I do remember being terrified. I think it's
Yeah.
natural. I think your whole world changes with that one diagnosis, and you're constantly living with this fear of how long am I going to be here for? You just can't help it. It's just natural to feel that way.
Mm,
Um, and I think it's taken me just an experience of knowing that the statistics aren't really up to date, and
mm,
they're, each person is their own story,
mm.
and there may be people who are still in that 1 to 3 year time frame that they give you for metastatic breast cancer, but
Yeah.
I'm living proof that I'm 8 years in,
Yeah.
and I know lots of other people in the community who are longer than me.
Yeah.
It's all about what drug works for you, and it's all about how you adapt to that drug and how you cope with that drug.
Mhm.
Um, but I just think don't be hard on yourself is what I would say.
Yeah.
I think it's very easy to think about all the things you suddenly can't do because of this diagnosis, but it's a massive adjustment in your life, and
Mhm.
there will be side effects that you don't quite know how to cope with yet. There'll
Mm,
be even side effects of your actual chemotherapy if you're on
mm.
chemotherapy, or there's breathlessness, there's pain, there's fatigue is massive, and I still struggle with that
Yeah.
every day. So I think it's about just taking it one day at a time and asking questions. And
Yeah.
for me, it's about finding community.
Mhm.
That's what was massive for me
Mm.
um, when I first found Make Seconds Count and
Yeah.
volunteering with them and sort of almost finding people that I could relate to, that I recognised, and
Mhm.
that I could share experiences with and I could share my fears with.
Yeah.
Don't underestimate how important that is. While we
Yeah.
might not all have the same story, we can all understand what those
Yeah.
fears are.
Yeah.
And reach out to organisations like Breast Cancer Now or Make Seconds Count or Macmillan, reputable
Yeah.
organisations that can point you in the right direction or signpost you to the right
Yeah.
things.
Yeah.
Because Google is very, very scary. if you don't know what you're looking for. And
Yeah.
I say that from experience, because when I was first diagnosed, it's the very first thing you do.
Yeah, I think a lot of
Don't,
people.
I think everybody's natural instinct is to
Mm.
go and try and find out things,
Yeah.
but it's about finding the right sites to go to that will give you informed information and
Mm-hmm.
helpful information, but will also signpost you to these community groups or, these forums that give you a safe space to do that
Mm-hmm.
in, which is massive.
Yeah.
And you shouldn't ever really try and do it all on your own,
No.
because not only are you facing the diagnosis, but your friends and family are facing the diagnosis too. So you almost feel like you're living it for them too. And I think it's quite important that you have a space where you can share your own fears
Mm-hmm.
that you don't necessarily want to share with your family. There's a lot of things that I've shared in, Facebook groups or private groups
Mm.
that I just want to get off my chest, or I just
Yeah.
want to share with someone else who understands. But it would be something that I would never tell my
Yeah.
friends or family, because they don't need to know that bit of it. They just need to know what's important.
Yeah.
But the day-to-day living makes everything so scary and overwhelming that you have to have an outlet for some of these things, and that's what I would recommend people do,
Yeah.
is find these other people who get it and who understand
Mm.
your
I agree.
diagnosis.
I think that leads in quite nicely with the work that Make Seconds Count does. We've got a question from Sarah as well about she's feeling very tired and short of breath a lot, but hopeful to go back to work. And you obviously work for Make Seconds
Yeah.
Count now full time, is that right? Or
Yeah,
you?
I work
Yeah,
4 days a week,
do
so I
you?
mean it's my
Yeah,
full time, but it's four
yeah,
days a week.
yeah,
Yeah.
yeah, yeah, yeah.
But when I was first diagnosed, I worked for someone different,
Mm.
and I found Make Seconds Count while I was working somewhere else. So,
Okay.
um, in that respect, I've always had very understanding employers, very
Yeah.
helpful employers who understood my diagnosis. But I do
Mm.
think that's really important,
Yeah.
is that you inform your employer of what's happening. You let them know that you're living with
Mhm.
cancer. Cancer is, we're protected under the Disability Act, which, if not everyone knows, I think it's really important to know that
Yeah.
your employer has to make reasonable adjustments for you and has to try and allow you to fit back into a working life if that's what you want.
Yeah.
What I would say is it's not for everyone. Some people don't want that. Some people want to just completely draw a line and focus on their health. And I think
Mhm.
each person has to make that decision for
Yeah.
themselves. I personally needed the distraction of work. I'm very much an overthinker. I'm very much someone that if I don't have distraction in my life, then I think I would catastrophize everything. So
Yeah.
I think the work side of things, it's also allowed me to remember a part of me pre-cancer.
Mm.
Do things that I still want to do and want to work. I also
Mm.
can't afford not to work, so that's
Yeah.
another element. I think that there's lots of different factors that come into it, but I think if you want to go back to work, I think it's important to speak to your team and let
Mhm.
them know what your capabilities are, or
Yeah.
what your treatment plan is, and when you're going to need time off, and where they can make the adjustments for you.
Yeah.
And I think that's hugely important.
Yeah.
But as I say, everyone will be different in what they
Yeah.
want. But I personally have managed to work. I work from home, to be fair, so there's a lot of things that have changed. So
Mhm.
I have a remote job that allows me to work from home, so there's a lot less commute that has to be done.
Yeah.
Because I do have fatigue and I am tired and things do
Mhm.
creep up. I have needed to go to 4 days because 5 days was too much, but
Yeah.
all those things I've sort of learned as I've gone along.
Yeah.
But work is still very important to me, and I was made redundant during COVID, and but at that time I was volunteering for Make Seconds Count as a
Okay.
patient, so that relationship already existed, and I was
Yeah.
very lucky in that I was working pretty much on a volunteer basis full time for them during COVID because I'd been furloughed prior.
Yeah.
And again, I had to keep busy and I wanted to do things, and I was very much behind what Make Seconds Count were doing, and
Mhm.
I wanted to help them expand, and sort of their support side was very much something that I was interested in.
Mm.
Um, so what I would say is every person is very different, but I would encourage you that if you do want to work, please don't think that an SBC diagnosis necessarily stops that.
Yeah.
Obviously, my circumstances will be different from everyone
Yeah.
else's, but I would like to think that every employer out there
Yeah.
would be accommodating to that,
Yeah.
or at least they certainly should be. And I feel that it's very much a life limiting illness, but for my situation, it hasn't stopped everything that I want to achieve, and everything that I want to do in my working life was important to me prior. So
Yeah.
that doesn't change just because you have this diagnosis. It might change how you achieve those things,
Yeah.
but for me, they're all still very important to me, and it is a part of me.
Yeah.
So I think for each person, they just have to weigh up what they want. I know there are other people that may have a job where it is impossible to carry on. I mean, I think there's a question there from Barry who said
Mm.
that, she was a teacher, and I think in
Yeah.
that environment, obviously lots of things would change because maybe
Yeah.
from
It's
a
very
health point of
different.
view,
Yeah.
or what you're doing day to day, you physically cannot do now
Mm.
as someone with a chronic life-threatening illness. But
Mm.
there's maybe other things that you can do. So it's maybe just about looking and seeing, is there other things that I can still use to fulfill my time?
Yeah.
I would hate to think that your whole life would stop just because of this diagnosis.
Yeah.
But I know I was very lucky in an admin environment that I
Yeah.
was able to achieve those things.
I think, yeah, it will vary what you do. Claire's mentioned that she's worried about having a compromised immune
Yeah.
system, which, yeah, as a teacher, I can completely understand. I guess, as you say, Claire, it's very much about having a
Yeah.
conversation with your team about the sort
Yeah.
of risks, and having a chat with
Yeah.
your employer as
I
well
mean,
about
I
that
think
side
it's
of
all
things.
ultimately going to depend on what
Mm,
your treatment will be going
yeah,
forward, and how that is going to affect you and your
yeah,
immune system, and how low is it going to be, and what is it going to be like interacting with your job. And
yeah,
but I still say you should always have those conversations
yeah,
with your employer, and hopefully you'll be able to come to something that still allows you to be fulfilled.
yeah,
I appreciate that might not always be possible, but I
yeah.
always hope that is for everyone.
Yeah, I agree. There's lots of useful information on the Macmillan website around
Yeah.
working with cancer.
Yeah,
So,
I would say, and
if
there's also a great
yeah,
website organisation called Working with
yeah,
Cancer,
yeah,
who
they're
do a lot
great.
of really good advice,
Mm,
particularly from trying to educate employers, I
yeah,
think, but also giving you knowledge of what you're entitled to and what your
yeah,
rights are. So I would always recommend looking at that as well as a starting
definitely.
point.
Yeah, yeah. Okay. Thank you, Claire. Are you happy to tell us a little bit about Make Seconds Count and the work that the charity
Yeah.
does and how you're involved with
Yeah.
that? Yeah.
Yeah, so Make Seconds Count is a charity that supports patients who live with secondary breast cancer, but also their friends and family. And our ultimate aim is to give them hope, and to aid in their quality of life. So we have kind of three pillars, which is research, support, and education.
Mhm.
So we fund work into secondary breast cancer.
Mhm.
Our aim is to educate not only our community but the general public as to what secondary breast cancer is,
Mm.
and everything that falls under that.
Mm.
And where I've become involved with the charity is very much on the support side. And in that, it's about supporting them in the day to day.
Mhm.
It's about offering things to them that will help them live with secondary breast cancer
Mm.
diagnosis, or introduce them to other people in their local area.
Mm.
So from the support side, what we've established is groups called Tea and Chat,
Yeah.
which is basically just that. It's friendship. So
Mm.
it's offering a safe space where you can come, and they're volunteer led by other patients.
Mhm.
But it's about introducing them to a community local to them so that they then have a support network near them, as well as what Make Seconds Count can offer online or in person. And we also have retreats that we
Yeah.
fully fund for patients. I think this year we've offered 6, which I think is the
Brilliant.
most we've ever done.
Fantastic.
And I think we're taking away a total of 136 patients
Oh,
all in
wow,
this year. So
amazing.
each year we've tried to increase what we can
Mm.
offer. And as I say, they're fully funded because we try not to have any obstacles that,
Yeah.
would prevent anyone from applying. And that just takes people away for a couple of days and, gives them a bit of respite. And again, meeting other people, but also treating them to nice food and some nice activities. And the other big thing that we have is our patient trial advocate service, which I know Breast Cancer Now have been involved in and have helped us with. And that's about helping people to understand clinical trials.
Yeah. Really
and we have I think we've actually, at the moment, we've got 2 nurses, who are working with us, and you can make a referral to our nurses and they will explain what clinical trials are, but they will also do a search for you and find out if there's anything available to you in a clinical trial form that you can then speak to your oncologist about.
And people can self-refer to that, Claire.
They can self-refer to that through our website, so which has been really successful, and it's doing really, really well. And I think we've helped an awful lot of patients already. For us, it's about wanting to help people in the here and now, as well as, wanting to offer as much as possible as a community. We've got a private Facebook group where, we support each other on a day-to-day
Barbara's
basis.
commented that she finds that really useful, the Facebook group,
I mean, I get a lot from it as the moderator of it. I'm forever learning things, and I just try really hard to, as a charity, we try really hard to look at the gaps, and if there are other charities like Breast Cancer Now offer groups, so if there's already a Breast Cancer Now group in a certain area, we would signpost to that. And we're looking to fill the gaps in other places where there isn't a group. And those groups will meet monthly, but we also have online services that do the same. So we have a twice monthly teen chat online, which is for anyone anywhere they can join. As long as you have SBC, you're welcome. But we also now have established a wellbeing program. So we have breath work and mindfulness. We have yoga, and we have Pilates, which launches in October. So we've tried very hard to expand what we're offering to people, and that will continually evolve and continually change. But for me, it's very much, from my job, it's about, finding these resources, finding these things, and then expanding them where possible, and continuing to offer more things to the secondary breast cancer community.
And what would you say to anyone that's keen to go to a group but feeling, terrified by the thought of it, which I'm sure everyone does before they walk through that door?
And I think that's completely understandable. I think anyone would feel that way, and I think it's natural to feel that way. I think what would be good is, we try very hard to share feedback from other people who've attended the group, but what I would say is just try and be brave on that day, and turn up, and you'll be welcomed, and you'll be looked after, and you'll be supported. It's a safe space. It's other people who are in a similar situation to you, so you don't really have to explain anything unless you want to. But I think what you'll get from it is a sense of belonging, a sense of friendship, and a lot of our groups have their own WhatsApp groups after that people can join, and they have that almost daily interaction, and you're almost creating a friendship, but it's a safe space where you can share things that, and I think that can't be underestimated as to how important that is for people.
Definitely. Let's have a quick look at questions. So Claire, the website that we mentioned is called Working with Cancer.
Yes, Working with Cancer,
And as Claire said, it's really fantastic. Lots of really useful information. So if you just search Working with Cancer, it should come up. Let's have a quick look. Armina, so you had an appointment today, MRI of your brain, and cried at the relief. Concerned targeted therapy doesn't protect the brain working full time. It sounds like a really difficult situation, Armina, at the moment for you. Some therapies do protect the brain, so I would have a chat with your team around that to get that reassurance. And it's yeah, I mean, I'm pleased that you've had some positive results, but obviously clearly feeling hugely anxious, which is completely understandable. Again, coming back to that anxiety again, Claire, isn't it? That waiting for results and
I
things.
think I think there's loads of things that you suddenly become very unsure about after you have a diagnosis. Like even things like with the wellbeing program, even things like exercise, you're
Yeah,
almost afraid
yeah,
to start doing things that will help you and benefit you because you're so worried that you're going to hurt yourself. And so I think it's about just readjusting to things and slowly gaining confidence that
yeah,
these things, you'll be looked after and you'll be, but you shouldn't shut yourself off to these things. But
yeah.
it's about confidence. And I think for some people, I think it's also about trusting in your team.
Mm,
Um, and sometimes that's difficult. Sometimes I've had difficult relationships in the past with some of my team, despite, me being stable.
yeah,
I think sometimes there are things that you want to talk about and you don't feel it's appropriate, but you don't feel you've got that open relationship. And
yeah,
I just think it's about being confident. And I think lots of people say it, but advocate for yourself, and that takes time. That takes time to, you know, be confident in yourself and your abilities. But if there's really something that you're not sure about, don't be afraid to talk about it. That's
yeah,
what your team's for. Your team's
yeah.
there to help you not only, with your day-to-day SBC diagnosis and your treatment, but to get you back on an even keel
Yeah.
is kind of what. But that's where other charities and other support services can come in handy to
Mm-hmm.
help you,
Mm,
with that, because we all know that your teams are busy and ultimately they're there just to make sure your medications are working. But
yeah.
there's so many other people that can be involved in your life that can help reshape it. And while it might not look like it looked before your diagnosis, you can still have,
Yeah.
a life with SBC, albeit very different from
Mm,
what it was before.
mm, yeah. Yeah. And I mean, it says she's scared to exercise because it's the hip and spine. So again, I mean, I would have a chat with your team. I
Yeah,
mean, there's lots of professionals out there that are trained to
I
help with people with a
yeah,
diagnosis of
I
metastatic cancer, and
I
I
think it's
think,
about
yeah,
speaking to a cancer exercise
yeah,
specialist. I think I've got bone mets in
yeah,
my, lower spine and my ribs, and I do the yoga, and I get a lot from the yoga,
yeah,
and it's helped me move again. It's helped me in lots of different ways.
yeah,
But initially, it's about speaking to that person. They'll always have a health questionnaire. They'll always have something that they want you to complete, and if they've got any
mm,
concerns, they'll speak with you. So you'll never be put in an unsafe
mm,
situation.
mm-hmm,
So I think as long as you're doing all those things and
yeah,
looking after yourself in that aspect, that
yeah,
the actual exercise itself could be of really great
yeah.
benefit to you.
Yeah, yeah. So I think, I mean, we know exercise is good for, as you say, physically and mentally.